Member of the Parliament and renowned president for this inauguration of this World Health Day 2025 event. SIMS Hospital is entering into the 12th year of its service in healthcare for the society. We have 250 bedded with 100 bed ICU, out of which we have 10 bedded neonatal ICU, 10 bedded pediatric intensive care units and the respective wards for the patients. This event has been organized for initiating and kick-off for the year-long campaign in relation to the World Health Day theme, Healthy Beginning and Hopeful Future. We are planning to do preschool and school health program focusing on growth planning, growth screening program, dental screening, nutritional screening, chest wall deformity and mental health well-being. These are our focus, and beyond that and antenatal mothers and newborn and the pediatric. This is the theme of this year. With this note, I would like to welcome Dr. Kalanidhi Veerasamy for this event, sir. Thank you, sir.
And my good friend from college days where we both studied together and worked together. And Dr. Manimeglai, pediatrician. And my friend Dr. J.V. Srinivas. And all the esteemed doctors and nurses. And the parents of children who have participated in this event. And all the staffs of SIMS and the media persons, warm good morning. The World Health Day has been celebrated every year on April 7. It was initiated in 1948, following a requirement that World Health is something which is imperative for the development of this whole world, and for the global health is a very important factor, especially in third world countries where 50 years ago the incidence of infant mortality rate, maternal mortality rate and under 5 mortality rates, the numbers were alarming. Subsequently, the world organizations have taken a pledge to reduce these numbers, and our country, India, has passed through several strides and achieved great numbers in terms of reduction in the incidence of maternal mortality rate, infant mortality rate and under 5 mortality rate. And the United Nations had set targets for 2030, and it is a very proud moment for us to say that Tamil Nadu has achieved those targets even 5 years before the deaths of those achievements. Tamil Nadu, especially under the guidance and leadership of our current Chief Minister, Honourable M.K. Stalin, as soon as the government was initiated, he had made a statement saying that health and education were the two eyes of this government. And to that end, the past 4 years and even before, whichever government has been in Tamil Nadu, they have always focused on education and health. Over the last 50 years, right from our great leaders like Perundalavar Kamaraj and Perarinyar Anna, and then our former Chief Minister Kalaidhi, and our even MGR and Jayalalitha and our present Chief Minister, all have strived to ensure that the well-being of people is of utmost importance, not only in terms of health, even in terms of eradication of poverty, where multiple schemes have been brought out, where empowering people, where those who are underprivileged are taken care of financially, socially, educationally, in terms of employment, and a lot has been achieved in the last few decades. Our rates of infant mortality rate and maternal mortality rate, our target probably should be 0, but now it is in the range of about 48 for maternal mortality rate and around 55 for infant mortality rate. And I would like to appreciate SIMS Hospital for joining hands with the government of Tamil Nadu in ensuring that this year's World Health Organization's theme, the World Health Day theme, healthy beginnings and a hopeful future. So healthy beginnings start with life where a child is born. So the importance of pregnancy, the care during pregnancy, antenatal care which is to be provided, and the immediate after delivery, those are the crucial hours where a life of a child has to be ensured, where the child does not undergo any kind of asphyxiation or leading to some kind of mental problems in future. So to ensure that SIMS Hospital, under the able guidance of its chairman and vice president and my good friend Dr. Raju, they have taken this initiative where they have decided to screen about 10,000 children, and I would like to congratulate them on this effort, and I would like to appreciate their effort. And he even promised that when we met, he had promised that even in my constituency we have a lot of schools, and especially my constituency of North Chennai has one of the most socially and economically backward people. The percentage of people is huge, and they have promised that they will conduct screening camps for pregnant women as well as for children. And the government of Tamil Nadu has also done a lot for pregnancy, where they have given cash incentives. You do not have to, it is totally free of cost, and if a child is delivered in a government institution, they are provided with cash incentives, nutritional support during the antenatal and postnatal period. So a lot of schemes are being done. But a government alone cannot do all the good work which a state as huge as Tamil Nadu with a population of about 7.5 crores needs. So we appreciate all the support which is being provided by private institutions. Because right now the statistics of private institution and the public health institutions, it's about 50-50. About 50% of the patients are being treated in government hospitals and 50% in private hospitals. So private hospitals, when they are providing these kind of camps and awareness programs, it makes it reach that last mile where these kind of achievements will go a long way. And I congratulate SIMS Hospital, and also they have several schemes like Tulir and Tulir and Miracle Nest. So I am appreciative of SIMS Hospital for doing all this, and I congratulate them, and I hope that whatever support they need from the government also, we will also be willing to extend our support.